another interview for the Raw Men podcast. As you know, the motto in this is to feature and promote people who are trying to do something to produce some good in the world. Somebody who has not only an idea, but are already working toward that. And today I'm speaking with Ovais Khalil, who is the founder of Humanist Health Care. Ovais, please introduce yourself. You give an idea of your background and this idea that you've implemented.
Thank you. And so, yes, I'm a cardiac trauma ICU nurse. I'm also the founder of Humanist Health Care. We discussed on the last time I was on, formerly a fundamentalist Christian, grew up in a Muslim background and veteran of the military. Humanist Health Care is a way to bring people together who believe in humanism. Started because I was actually denied the chance to volunteer with Samaritan's Purse because I'm not a Christian anymore. So,
did I understand you to say that you grew up with a Muslim background? Were you Muslim?
My family was practicing Muslim down in Mississippi. I always questioned Islam, however, but to tell you the truth, I was a practicing Muslim, but never really took it seriously. My biggest fundamentalism was Christianity.
Okay, fair enough. All right, so do please continue. Sorry to interrupt.
Oh, no. Yeah, so Humanist Health Care, since our last discussion, we actually had our website's been up, and our community has been growing. I've been actually somebody from Australia emailed us wanting to join our group. So so Humanist Health Care is a global project of the Washington area secular humanists. Our purpose is to promote a community for humanists who want to volunteer and do healthcare related activities.
Yeah, I must apologize. I have dogs here who are running sentry at all times. So if there's any annoyance that their miraculous ears can detect, then they're going to have a conversation with whatever is the source of that noise. So I've had to be on mute for the last 2 or 3 minutes.
It's not a problem.
Yeah, I've heard next to nothing as I've had them going off on both sides. I hope that's not an issue. So when you got this started because you were denied the option to volunteer for a Christian variant of a healthcare system, but because you're atheist, you weren't allowed that chance. So you came up with the idea to put something together yourself. How does one go about doing that?
To tell you the truth, it's actually getting your voice out there. I'm an active member of Washington Area Secular Humanist. I brought the idea to Mike Reed, who is the current president of WASH, and he actually came after Samantha McGuire, who I think you know. So I brought the idea up to him, and he thought it was great. We started very small. It was literally just me, my wife, and a couple people. And then since the last time I was on the interview, now our membership has grown to 35 people, and now we're even growing further. Our Facebook group has been attracting a lot of people. There's been doctors who've been emailing me saying, I'm a humanist. I really want to advance humanist causes. And so it's just been so humbling. And the support's just awesome. In fact, one nurse actually told us recently that I feel it was a really touching story about how she felt like she couldn't come out in her workplace, specifically because she knows patients would fire her as a nurse. But patients would say we don't want this nurse because she's an atheist, or, her coworkers would shun her. So stories like that, it's humbling and tells me why I need to continue doing this.
Yeah, can you imagine turning somebody away because a nurse came to you and as long as they're using medicine and not witch doctory, then it wouldn't matter to me if they believed in miracles or what have you. As long as we're going to go with the medicine first, I think I'd be okay with that.
Yeah, definitely. But there's a lot of people, especially depends on where you're located too. It's a lot of times, the American Nurses Association says nurses are technically required to bow their heads if a patient wants to pray with them. And you can say you're an atheist, but I guarantee you patients would act a certain way, and so would your coworkers.
Okay, I hadn't expected that.
Yeah, it's actually
so when you say you got 35 members, what does a membership consist of?
Membership currently consists of community. Our current goal, eventually, we do want to do humanitarian work, and we're putting ideas out there for small projects like a smoking cessation classes, just starting out small. Right now, membership though entails being a part of something, putting ideas out there, talking about how you can make a greater impact in your community. We have, and this is healthcare workers and non-healthcare workers. A lot of non-healthcare workers are just coming up and saying, I want to do things like create COVID kits with hand sanitizers and give them out. I want to buy masks and leave them at convenience stores so that they could give them away for free.
Now, that was the next thing I wanted to ask you, having to do with the masks thing. I am mystified at how so many people in my country seem to have just lost their all sense when it came to this COVID thing. Now, I already knew that any situation where John Q. public in this country are asked to do anything different than they ever done before, as a regular routine, they're going to balk at that. When the city provided free recycle bins for recycling plastic and glass and that sort of thing, people got upset over that. How can you inconvenience me to make a decision to sort my trash? People react because they don't want to do a damn thing. And so when somebody's listening to, we were in a lecture talking about environmental issues, and of course, a lot of people react to any kind of environmental issue. And so there's a guy there who drives a '69 Chevy Chevelle with a 454 and a 4-barrel, gets shitty mileage. He gets like 3.5 miles a gallon, but he's got 500 horsepower, right? So he's going to stick with that. He says he's not going to do anything different, and that's the attitude. They're not going to do anything different. I don't have to change. It's everybody else that has to change. And if everybody else changes, then that'll be fine. I don't have to do squat. I can go do the regular thing that I was already doing. But now we come to this. And I don't know, is it that the virus is invisible and so people can pretend that it doesn't exist? I mean, all these people say that it's a hoax. How many tens of thousands of people have to die for you to say that this shit is a hoax? And you understand why the doctor wears a surgical mask when operating on you, right?
Right.
It's not because he's afraid of fumes coming out of you. He's protecting your opened insides from his breath, from his spittle, and so forth. That's the way that works. You wear a mask not because you're afraid. You wear a mask as a courtesy. And I wear a mask not just as a courtesy, not to get the people sick that I might be dealing with in the grocery store or what have you, but because I have a family and there are people in my family who are immunocompromised or have weak respiratory heart situations anyway. And we understand that this illness, if you survive it, you come back with permanent heart damage.
True.
That's serious enough to extend the courtesy for my 76-year-old mother and other people in her situation. I don't understand why other people have this huge damned issue where they won't wear a mask unless they're absolutely forced to, and sometimes they have to be physically forced by the police to do it. I had an encounter like this in a drugstore just a week or two ago, where somebody walks in without a mask and makes a big damn deal of the fact that he is not going to wear a mask. Why politicize this?
I think that
from your perspective, because I think I've ranted enough.
No, it's this is some. I actually volunteer with the Department of Public Health in Maryland, so we run into this. So there is an anti-science bias in this country. Dr. Fauci said it perfectly, and one thing people don't realize, people say that people want to pretend this is something we've had before. And even yesterday, I was talking to a doctor about ventilator settings and how to send a ventilator. And I was saying, this is kind of unusual. These are unusual settings. Normally with people with respiratory issues, we do it a certain way, whether level of oxygen versus level of PEEP, science terms, which I don't want to bore your audience with. But he said, we don't understand. This is not respiratory distress syndrome. This is COVID. COVID attacks differently. We don't know how to do it. And fact of the matter is, when we thought when COVID started that we needed to intubate everyone. We thought that we needed to start intubating. And now we're discovering intubation actually increases the chances of mortality. We don't have the treatments. We don't know. There's so many unknowns. You can't figure things out in 7 months. And the people in this country, honestly, I feel hate change so much and aren't willing to have that science bias. We are the most religious country in the world. I don't know if you've heard of John MacArthur, who's out in California, big church pastor who is encouraging millions to continue attending churches. And even today, I went bike riding by a church, and it said that church is essential, Hebrews 10:5, and you got to just smack your head. It's
I've seen a number of people going into church congregations, so like on the news and such, that they're not going to wear a mask. They're not doing social distancing. They're protected. They're immune because they're soaked in the blood. And look how many people have declared themselves to be divinely immune, or worse, healers. And it's not just with Christians. I've seen it from Muslims. I've seen it from, there was one evangelical Christian in Africa that I thought was particularly amusing, where he goes around, I think he was kissing people to cure them. And of course, he's dead now from the very thing that he thinks he's pretending to heal people from. And there was a Hindu also who, again, dead from much the same kind of treatment. You know,
right.
That would be my only aversion to having, Christian healthcare. If it's a religious person, okay, you understand we're going to use the medicine, not the spells.
People have this weird bias I've noticed in this country that if you have a degree or an advanced degree and you're a Christian, you're smart. But if you have an advanced degree and you're not a Christian, you're an overeducated bastard. So
he got book learning, but he ain't got no common sense.
Yeah.
That's what I heard throughout my childhood.
Exactly. That's there's issues with that. In fact, right now I'm actually trying to work on a debate with the head of Reopen Maryland. We're trying to schedule a debate and talk, more or less a fireside chat where we talk about why reopening completely is a bad idea. And if you go around and see why, like if you go to one of their rallies, you'll see people saying we need to reopen. This is no worse than the flu. You can present data in people's faces and they'll still deny it. That's something I don't understand about this country. You can just pretend that the problem's not there.
Yeah. Just go on about your day until everything gets worse. So I see this other guy who he goes to like a Trump rally and he tells everybody to cough in his face because he's so insistent that this is a hoax. But this is a family man. He has children like me. I'm sure he has an elderly mother. So this guy goes home and he could be one of the many people who are asymptomatic, meets somebody at the Trump rally who is asymptomatic, because there's a high percentage of people who are. And then he goes home and maybe infects and kills maybe one of his kids, his mom, just out of the stupidity. I don't get this. And another problem that I have is there are people who I respect in the skeptical community who have issues with masks and who think, just like you would think a religious person would. I mean, that why are we doing the masks? Because masks are not 100% absolute. Nothing is 100% absolute. Get over it. If I'm wearing a mask, and if one of us is wearing a mask, you're not wearing a mask, I am. And I had to explain this to somebody that was working at a counter, in a convenience store. She's dealing with 1,000 people an hour, right?
Right.
So I'm trying to explain to her, you don't have a mask, I do. If I'm sick, then you have only a 30% chance of being infected by me. If you're sick, and I'm not, I have a 70% chance of being infected by you. I'm the one wearing the mask, but I have a 70% chance of infection. If we're both wearing masks, we have a 1% chance of infection. Keeping our regular distance, being sensible enough to wash and sanitize and that sort of thing. I mean, I got a little hand sanitizer hanging off my key ring. I've got the other things too, like, some things for pushing buttons or opening doors when you're in high traffic areas and questionable circumstances and that sort of thing. If the country had been on board, if everybody had been on board with the new fashion accessory that we can wear different kind of masks, and I've got some good ones. It's not that we have to wear masks; it's that we can. We now have the ability. We get to wear masks. If everybody had been on board with this, of washing your hands and social distancing and wearing masks. We could have beaten this in 2 weeks early on. And instead, the United States has the highest mortality and the highest infection rate of the planet. Does that make any sense?
Well, you can get me going on the reasons why. I mean, one, universal health care, contact tracing, other issues which we weren't prepared for. And just my personal opinion, spend so much on defense rather than other other concerns. We dropped the ball here. And I think one of the goals of Humanists in Healthcare is to promote science and evidence-based practice. That's part of our mission statement. And I think the secular community, especially because we are guided by science, we are guided by evidence-based practice. We need to get out there and start stepping up and speaking out. We need more secular. Though I think the key to this is getting more secular voices out there, running for Congress, running for your local elections. A lot of times I think we stay silent because we don't want to. But I'm recently coming out more. I think I told you in our last interview that was me coming out to my coworkers that I'm an atheist. So now, cat's out of the bag. Yeah, I'm not only an atheist, I'm an atheist activist. So it's important to get our voices out there. It's important to speak up.
Let's explore what you said. Don't get you started. I'd like to get you started. Give me a couple of things on how America dropped the ball on this.
How America dropped the ball on this. First and foremost, we knew that this was coming. We saw the signs. We should have had contact tracing. We should have had testing at the airports. This is my belief. I'm not the expert on public health. I really am not. So this is just a low-level nurse's belief. And so we dropped the ball on that extent. Second, we didn't take the appropriate prevention measures. We should have had mask mandates out immediately. I mean, we should have had a national mask mandate would have solved this entire issue. If people
that I often think about, there's no way to test the numbers, but how many times have masks stopped the spread? Because using masks, and a lot of people have argued that we should use herd immunity, which means that we don't do a damn thing and we just sacrifice tens of thousands of people for privilege. But look at all the people that would have to have been spared infection by the fact that they're wearing this simple piece of homemade 2-layer cloth with a pipe cleaner in it, or something similar.
Well, so this is one thing people don't realize now. COVID is going to be a part of our lives, in my opinion. I think it's a doctor came out with NIH fairly recently and said that we're probably going to end up having to take shots for COVID for the rest of our lives, like the flu. You can't have herd immunity with the flu. Why? Because the flu evolves. The flu changes. You can't go get herd immunity. Next season, there's going to be a different kind of flu out there. And we believe this is what's going to happen with COVID. There's actually a chance of this happening. So
what are the actual numbers, though, on the flu? Because it was another stupid excuse. The flu kills some people, and COVID is not that much worse than the flu. If it was only 10 times as bad, which I think was the original numbers, then that would be the case. But I actually think it's worse, and it's a little bit more insidious. Fortunately, some of the bad news has been curtailed. I was seeing a number of reports that antibodies disappear in a period of 3 to 6 weeks.
Oh, yes. Oh, I think they said a couple months. It depends on the individual.
Yeah, 3 to 6 weeks. And well, that would be 4 weeks, but anyway, so yeah. However, the implication was that there was no long-term immunity, and if you couldn't get a long-term immunity of even 2 months, then an inoculation wasn't going to matter at all. You'd have to do a different type of vaccine technology than what I'm aware of. But fortunately, I did see a report more recently, like a week or so ago, that said that they have, even though the antibodies are disappearing, that there is indications in the T cells that there is a long-term immunity. Well, good, because if there was no long-term immunity, then what the situation is if you were to catch this disease again with the pre-existing damage that was caused by the first time, and then you're susceptible to it all over again, it will eventually kill you.
Yeah, and and right now and a lot of this is we don't know. And when you're hoping for the best, or you're hoping for prayer to get you through this is you're not gonna you got to prepare for the worst. And like I said, we dropped the ball. In fact, I was one of the first nurses in my hospital, in my ICU, to take a COVID patient, and I actually remember that. And actually, I think I was the very first in the ICU. And they said, I remember them calling up, "We think we have a coronavirus patient. Can you can you come and take her, or him or her?" And so I remember that when that patient came in, and then all of a sudden 2 days later, that was just one person in a room in a 50 plus hospital. Now all of a sudden, 2 days later, every room was filled, and it was a COVID patient. The way that this overwhelmed us, we were running out of gowns, we were running out of masks. We had nurses fearing for their lives. We had people like just saying that, this isn't what I signed up for. This was if you were on the front lines, people, what's happening, and it's sad that people are willing to sacrifice the ones who are trying to care for them, the ones who have to face them, who have to face down this virus, who don't have an option, who, if we say we don't go to work, more people are going to die, and that's heartbreaking, and it's sad.
Yeah, I mentioned that some of the masks that I have, the two pieces of cloth, some of them have a replaceable washable filter. So the mask itself is washable. They have more than one, and then there's a filter inside and it has a clasp so that it gets a decent kind of a seal over the nose, so that your breath isn't coming down from below your eyes. You're not breathing in over the mask. You're breathing through the mask. So, and that's important, because of what I see a lot of, I go to the grocery store and I see people with the mask under their nose. The hell are you doing? There's not even a point in wearing the mask if you're going to wear it under your nose.
Oh, definitely. I think it's important to tell people about that. The other day, I believe personally, it's also how you say things. I actually, when I see somebody in a convenience store going in and not wearing a mask, I say, "Hey, I'm actually a nurse. I have a mask in my car. If you don't have one, I can just run out to my car and give it." And they're usually pretty nice about it. And if you say, "Hey, man, I'm trying to keep you safe. Hey, man, don't wear it under your nose. Just put it up, trying to keep you safe there."
I went into some place a couple of nights ago where I have to buy something over the counter, and the girl's got a mask on, and we're a good distance away, like it's supposed to be. Okay, everything's fine. We're not using cash; it's all credit cards, so it all should be good. But we ask her a question, and she leans in and pulls the mask down, because apparently we can't hear her speak unless she takes the mask off to speak directly into our faces. What the fuck is wrong with you?
Right.
I'm just really disappointed in the stupidity of people, that they actually think that this is a hoax to be sure that we'll behave, that we can be manipulated, right? And who's perpetrating this hoax, right? Both sides of the political aisle, the conservatives and the progressives. Absolutely everybody in the planet is all in agreement on this. Everybody. There's not even a common enemy, and there's no possible purpose for it either. The fuck is wrong with people? How are they so dumb?
We could go on about the conspiracy theories. If you I once in a while, just for the shits and giggles, watch Christian television.
I do too when I want to get mad.
Yeah, exactly. I watched the televangelist, and I think there was one that said that he had a vision of the coronavirus being built in a Chinese lab. Nancy Pelosi was there and everything. It's hilarious, but it's hilarious and sad, because people do believe this. People follow these instructions, and it's hard, but I think it's our duty as secularists, as humanists, as anybody who puts science above superstition, to come out there and speak, and one quote that I made from Humanist and Healthcare is, "There's nothing more humanist than healthcare. There's nothing more humanist than coming out there and taking care and caring for somebody else's health."
Yeah. Yeah, and even Christians can be humanist in that respect when they resort to what is it, real world solutions for real world problems. That when they do, because humanism is in its essence the realization that humans have to come up with their own solutions to their own issue. That prayers are not going to be, let's not say that the prayers necessarily won't work, but the prayers are not going to be reliable. That thoughts and prayers are not going to get the job done like working hands and donations.
Oh, definitely. And we actually have a couple Christians in Humanists in Healthcare who they love. They're great workers. They're amazing people. They have good ideas, and you wouldn't even tell that they are religious in any way. But they love the fact that they can actually promote science, and that's very important. Currently we need more people out. Like I said, I can't stop stressing that enough. We just need more. We need to start speaking up. We need to start coming together, because the voices of the churches, the voices of all these organizations that saying this is a hoax, saying that they're essential, it's a loud voice. It's going to get people killed.
Yeah, well, yeah. What are you going to do? I've lost an awful lot of my faith in humanity the last few years, and the COVID hoax paranoia kind of crap. It bewilders me that the same people who argue that this is a hoax, I'm going to try to reason with them to show them that it's not a hoax, but then they also believe that what was something that was turning our frogs gay? I don't know. Then there's extraterrestrial reptiles from the Sirius star system who have disguised themselves as humans and are infiltrating the Illuminati. And I'm like, I give up. I'm just going to have a strong drink and enjoy the sunset.
The extraterrestrials, they might just be trying to help. Maybe they're not all bad. Maybe they have a way to stop COVID.
All right. Well, Ovais, thank you very much for being on again and for having this follow up talk, because I really, this has been something that's been bugging me. Every time I see somebody with their nose poking, I was like, I want to ask them, hey, do you walk around? You have a legal requirement to wear pants. Why don't you just let your dick hang out of the top of it? I mean, wouldn't that be the same kind of thing as sticking your nose out of the mask? But there's so much you have to explain to people that they're not going to get.
Oh, definitely. And I just want to say, it's important to speak out. So just if you see something, I hate to say it like this, if you see something, say something.
I've seen that with some paranoid applications, and we were talking about paranoid people, so I'd be hesitant to say that, but I get the gist.
Definitely.
All right, Ovais, I thank you very much.
Thank you, sir.